Hello, I'm Dr. Steve Hotze, and welcome to Hotze Health and Wellness Center Heart Health Webinar with Dr. Derrick DeSilva from New Jersey. He's flown all the way in here to be with us today for this webinar. I believe that you need a physician and a staff of professionals who can coach you on a path of health and wellness naturally, so as you mature, you've got energy, vitality, and life, and you've got to have a healthy heart to have vitality. Isn't that right, Dr. DeSilva?
If it doesn't work, it's going to be a problem if you don't.
So I'm excited about this because we're going to show you how you can keep your heart healthy if it's healthy now. And if it's not healthy, we're going to show you how you can get it healthy. Dr. DeSilva is from New Jersey. He's an internal medicine physician there in New Jersey, and he specializes primarily in heart health. And he's a prominent presenter at the American Academy of Anti-Aging Medicine, where he's presented for well over 20 years. I heard him several years ago, and when he talked about heart health, he talked about a topic of heart health that I had never heard discussed before. And I've been in the practice of medicine now 46 years, and nobody ever talked about this. And when I ask other physicians if they know about our discussion today, when you hear this, you're going to know more than 99% of the doctors in America about heart health. Now, Dr. DeSilva is the past chairman of the Age Management Medical Group here in the United States, and his main focus has been on how to help people obtain and maintain health and wellness naturally as they mature. So he would be a functional, integrative doctor who uses more natural approaches to health to help people get well rather than depending upon pharmaceutical drugs, and that's what really attracts me to Dr. DeSilva. So, Dr. DeSilva, let's talk about heart disease because, as you well know, the leading cause of death, folks, in the United States is not COVID. It's heart disease. And it's still heart disease, and it's been that way for decades. It's heart disease. And so we hear very little about heart disease, and you hear everything about something that can be easily treated and overcome, and that's infectious viral respiratory diseases, which we have every year. But heart disease is something that causes major problems. And when we talk about heart disease, we're not just talking about the heart. We're talking about cardiovascular diseases. So that has anything to do with the arteries in your body. So that includes strokes, peripheral vascular disease, kidney disease, liver disease, cardiovascular heart disease, heart attacks, congestive heart failure, high blood pressure. All these are bundled under the topic or under the name cardiovascular disease. And it's important to have a cardiovascular status that is optimally functioning so you can be healthy and well, because you know the heart carries your oxygen and pumps the blood that carries the oxygen to your cells to enable your cells to produce energy in your power plants, the mitochondria, so you can make the electrical current that makes your cells work well, that makes your organs work well, that make you work well. So it's at the basis of everything, you've got to have a healthy cardiovascular system to have a good functioning life. So, Dr. DeSilva, let's talk about the underlying cause of heart disease, of cardiovascular disease. Most people think, if you ask the average doctor and you ask the average person on the street, what causes cardiovascular or heart disease? They're going to go like cholesterol.
Right.
Wrong. That is not the cause of any cardiovascular disease. In 99.99% of the patients, that is not the cause. So what causes cardiovascular disease, and what in the world can we do about it?
It's one word, and that's inflammation. Can I leave now?
That's it. Inflammation.
That's it. It's inflammation. And, this is one of the things that you and I have been talking about for decades.
Right.
Not years, decades.
Right.
It's been decades. 60% of people that have heart attacks have normal cholesterols. 60%. And this data comes from various institutions, vascular surgeons, etc. Right. So if we look at heart disease in general, we look at and we say, how does inflammation happen? What happens? How do you get inflammation? Well, diabetes is definitely a cause for cardiovascular disease.
And that's because you have elevated blood sugar, which causes
inflammation.
causes inflammation. It raises the insulin level, which is hyper-pro-inflammatory.
Exactly. High blood pressure.
Right.
High blood pressure has an inflammatory component to it. Cholesterol does not have it has a very small inflammatory component to it. But the other thing is smoking. Smoking is a horrible, and has a horrible inflammatory component. So when you say, oh, by the way, family history has an effect on that also. These are risk factors for heart disease.
And other things, the simple things like viral infections, gum infections in your teeth. You've got all kinds of bacteria, and they get disseminated into the blood, and they end up landing in the arteries of the heart. And guess what? It causes inflammation. What about mercury? What
Absolutely.
about
Heavy
aluminum,
metals.
heavy metals? All these cause inflammation. So all of us are exposed to this, which causes inflammation in your arteries. And guess what? The arteries that are under most pressure are your coronary arteries. Why? Because if you think about it, think of my heart. My hand is a heart, and think of this vein you can see going down my hand. Think of that as the left anterior descending artery. And when it's inflamed, the heart's beating 70 times a minute, every hour, every day, 24/7 for your whole life. And if there's inflammation in there, that starts to deteriorate. And that's a big, bad problem. So inflammation is a major cause of heart disease. And what happens, of course, when you get inflammation, your body wants to repair it. And what it does is it lays down lipoprotein A, which is a cholesterol protein molecule to bandage the heart. That's why the mainstream doctors and the pharmaceutical companies say, well, cholesterol is the cause of heart disease. Well, you wouldn't be putting a Band-Aid on your arteries in your heart if they weren't inflamed. If you get control of the inflammation, you get control of heart disease. You're not going to develop heart disease or cardiovascular disease.
Absolutely. And I think the other thing, you made a really good point, and I really like that point, because they have looked at plaque inside the coronary arteries, and they've looked at people's dental plaque from their teeth,
Right.
and the same organisms that are in the plaque inside the coronary artery, inside the vessels of the heart, are in the plaque of their teeth. So this is a very, very important piece that we go through.
Let me interrupt you on that. It's an interesting point, and farmers and ranchers know this. You've heard the old expression, don't look a gift horse in the mouth.
Yes.
You know why that is? Because you can tell the status of a horse or a cow by looking at its teeth. They know that if you were going to buy a horse or a cow, one thing you look at is the teeth. If the teeth are unhealthy, you don't buy the animal. So the expression is, if somebody gives you a horse, they're giving it to you. You're not buying it. Don't look in their mouth to see if their teeth are any good. That's kind of like a slap in the face. Just say thank you. But don't look a gift horse in the mouth, because your teeth tell you everything about your underlying health, and they have a dramatic and there's some. I know some dentists that have focused on heart disease, and they were dentists, but they became very interested in heart disease and how you can maintain good heart health by simply having good dentition and good gums.
Well, I had to come to Texas to learn that today. So because I did not know where that expression came from, and I'm very glad that I came to Texas, and now I know where that came from. So I will make sure I look at a gift horse and say thank you.
Right.
So not do anything. But seriously, this whole idea of cardiovascular health, every 60, the statistics and the data is this: every 32 seconds, somebody in this country has a heart attack. 600,000 people die of heart disease every single year. It is still the number one killer. Not close to cancer, not close to motor vehicle accidents, not close to anything else, infectious diseases, etc. So it still is the number one killer. And what we have not made literally no inroads into decreasing the incidence of heart disease in this country.
Even though we've got millions and hundreds of tens of millions of people on statin drugs and all kinds of
it's
heart
a
medication.
multi-billion-dollar industry, and that's the cholesterol medications that are prescribed out there. Now, if that were the case, we should at least be dropping the incidence of heart disease by 1%, maybe 2%. We haven't made any dent in that, if that is actually
Right.
true. So there's a very small anti-inflammatory component with the statin drugs. But that being said, there's no data to suggest that a woman should be on cholesterol-lowering medications at all. The only indication that there's out there for a woman to be given a statin is if she has had a heart attack. And even in that situation, it is likely better to fix her hormone status and protect her heart by giving her bioidentical estrogen versus giving her a statin.
Right.
So this data is very compelling. For men, a little bit more of a fudge factor. The men can have and should lower cholesterol, but not to the degree that we're trying to do it today. Your brain is 60% fat, and your eyes are 60% fat. If you start taking fat out of your body, you're going to have some serious neuropsychiatric problems.
Well, you remember Dr. Gravlin wrote the book about amnesia. And here's a physician that worked at Nassau. And he was put on statin drugs, and he just lost who he was.
Yeah.
And so he goes to, his wife takes him back to the doctor 2 or 3 weeks or a month later, and the doctor had enough sense to say, take him off the statin drugs, and it came back. His mind came back.
Do you
like
know
that.
how many people I have seen over my 34-year career that have had this issue? I have people who came in. I had a gentleman who I see down in Florida, a dear friend of mine, whose father-in-law is 93 years old. As we speak today, he's flying his plane solo across the country.
Wow.
93. The man is amazing. When I first saw him about a year ago, he was on a statin at 93. I looked at him and I said, Gene, for what? He said, well, my doctor told me my cholesterol was high and I started. I said, when did he start you on this? Oh, a couple of years ago. I said, Gene, you're 93. What? I don't get it. And he said, Doc, I need to take naps in the afternoon now. My brain is not working the way it should. I said, look, are you taking CoQ10? He said, who? I said, coenzyme Q10. Your doctor didn't tell you about that? He said, no, not. Took him off his statin, put him on some CoQ10, gave him a bunch of nutrients. He said, I have my life back. I have my life back. He's flying as we speak cross country. And in fact, his son, one of his sons, I think he's got 5 or 6 boys and one young lady. They all live. One of them lives here in Houston.
Right.
And I just don't get it. I don't get it. I don't understand why physicians aren't paying some more attention to what we're talking about. You know what it is? I think what it comes down to is it's difficult. We have to sit and talk to people and explain to people what's going on. And that takes time, let alone explaining to them what the endothelial glycocalyx is.
Right.
Who's that? I mean, where was this person born? So,
Well, listen,
so much.
When I was in my surgery internship, we had to do a rotation through internal medicine. Dr. Herb Fred was my professor. He was a great genius. So when we presented our rounds on Monday morning, our rounds to him and presented our patients to him, we would explain, what the patient had and what our diagnosis was. He said, why do you think that's right? And we go, well, because, and we give him an answer. He said, why do you think that's right? And he kept asking you why, like Socrates, until he had you butt naked and you didn't know why you thought it. And he said, here's the problem with you physicians, all you physicians and most physicians. He says, they don't like to think.
Exactly.
And he said, let me tell you why. It takes time and it's hard work.
It is.
So one thing about Dr. DeSilva's a thinker. He's a presenter. His presentation, the slides you're going to see as we go through here today are just absolutely tremendous. I learned more about heart disease in the one lecture. I heard him several years back at A4M. And I'd been through cardiology, and I did a cardiology rotation when in my senior year in med school, and I love cardiology. I've read all about it, but I'd never heard about his topic of how inflammation affects the endothelial lining. That's the lining of the inner lining of your arteries. It's called the endothelium. Endo means inside, inside the artery and in the blood vessel. So anyway, so let's talk about the inflammation. What does the inflammation, and I want to get right to the point. What does the inflammation affect that most doctors don't know about?
There's a lining, there's a single cell lining within the inside of the blood vessel. It looks like shingles on a roof, right? So if you have shingles, they're overlaid slightly on top of each other. That's exactly what the lining of inside of the blood vessels, the arteries, the veins, the capillaries, all of them, even the lymphatic system. When that single-celled layer gets inflamed, gets damaged, what happens when those shingles that are like this?
What are they called? What are the shingles called?
The endothelium.
But what about the glycocalyx?
Right. But the glycocalyx is a layer that is above that endothelial layer. If you have the shingles here, you've got a layer of let's call it like a Teflon protective layer above it. If that layer is functioning and doing what it's supposed to do, protecting the blood vessel, it's fine. You can have all the cholesterol, you can have all of everything going on, it doesn't matter. But when this layer gets damaged and it shrinks and it reduces to almost nothing, this endothelial layer now becomes susceptible to damage. The shingles, when blood flows, will start to lift. When those shingles lift, that's where the fat and the plaque and all of it starts to collect. So that is the genesis. That is the beginnings of the damage. This damage, how does that happen? Inflammation.
Right.
Too much sugar, too much smoking, too much stress. That's where that happens. Even food will damage that layer, but it rebuilds. It rebuilds in about 6 hours. So there's all the theories of, okay, what about grazing? What about people that graze, that eat every 4 hours? What's going to happen is you don't have time for that layer to rebuild. My theory has always been eat 3 meals a day. If you get hungry and you need to eat some almonds or something during the day, no problem. But I don't like the idea of grazing, Dr. Hotze, based on the fact that I know that this layer takes 6 hours to rebuild.
Well, this is why people recently, you've heard a lot about intermittent fasting.
Exactly.
People that just say eat once a day.
Well, the whole idea with intermittent fasting, the reason I like, and I've been doing intermittent fasting now for about 5 years, the reason I like intermittent fasting is it completely allows that layer to rebuild because you've got about 18 hours of fasting. So that whole area is going to rebuild, but there's so many other benefits with that, right? I mean, increased growth hormone, decreased insulin levels, et cetera, et cetera. So the idea of that layer rebuilding is extremely important.
And this layer is called the glycocalyx.
And that glycocalyx layer is made up of complex sugars, not sugar, right? These are They're called polysaccharides. They're peptidoglycans, glycoproteins, glycans, aminoglycans. These are all complex sugars that make up this hair-like, gel-like layer. Now, the analogy of this is this. If you take a fish out of water, right out of the water, if you're fishing and you take that fish out of the water, what does that fish feel like?
Well,
it's slippery.
Yeah.
The fish has a glycocalyx layer on its body that allows it to swim through the water with no resistance. The surface of your eye, the surface of our intestines are coated with this glycocalyx layer. It's a slippery, gel-like layer. When that layer is intact, everything works well. When that layer gets damaged due to inflammation, due to increased blood sugar, due to smoking, etc., that's when the problems begin. So the question always comes down to is, wait a minute, I just had a patient who is in her 60s, came into my office, said, I'm not feeling good today. And she never complains. This lady never complains. Came in and said, I'm not feeling good. I said, what do you mean? And I examined her, talked to her. Remember, women present with heart disease very different than men, right? Women will present with a little bit of GI discomfort, a little bit of abdominal discomfort, and it's exactly what she had. She really had no risk factors. She had an underactive thyroid. I did a cardiogram on her, and there was a very subtle change. A very subtle change. I said to her, look, I want you to go to the hospital. She said, Doc, I'm fine. I just don't feel right. I said, listen, go to the hospital. She had a triple vessel bypass that night.
Mm-mm.
Guess what her cholesterol was?
What?
160. Had nothing to do with her cholesterol. She was a menopausal woman. She had no estrogen, which is a major risk factor for heart disease. So that layer.
That's an important point. We see women develop their coronary artery disease approximately 10 years later than men. That's why women tend to have a longer lifespan than men do. The estrogen hormones women make are protective
For the heart.
For heart health.
Right.
And so when you go through the change of life at 50, that's when women begin to start developing their problems, as opposed to men who can develop it 10 years younger.
Correct. And that's because, the whole idea of women making sure that the presentation, right? Women who have these GI problems, et cetera, they have to pay attention to that, and they have to make sure the doctors are paying attention to that. But the whole idea of protecting that layer is critical, and that's where the Artiracil comes in. And here's another analogy that I like to use. People say, well, how do you know what this does and how this works and
well,
what
let's talk
the role
about,
is?
we're just bringing this up. First, the problem that causes coronary artery disease, remember this, is inflammation. And inflammation is caused by people that eat high sugar diets. So you're eating a lot of sugar, or you're eating a lot of simple carbs like corn, potatoes, rice, wheat. All your bread products and your cookies and cakes and all this are starches that convert to sugar, and sugar is inflammatory. It raises the level of your insulin. That's pro-inflammatory. That's a big problem. People with bad teeth, they get these organisms disseminated into the blood, and they get incorporated into the plaque in the heart, and that causes inflammation in the coronary arteries. People that have that are eating out of aluminum, they get all kinds of heavy metals. There's heavy metal that maybe you get in your water or other products, or you have mercury amalgams in your teeth. All these cause inflammation in the coronary arteries, and that's what deteriorates the glycocalyx, which is the lining on top of the endothelial layer of your arteries. So the glycocalyx gets inflamed. And then the body starts laying down cholesterol, trying to patch it. It's a backup mechanism.
It's exactly the mechanism that happens.
It's a backup mechanism because the body doesn't want your arteries to deteriorate and just fall apart. So then calcium's absorbed into those plaques, and that gives you atherosclerosis or hardening of the arteries, which in and of itself initially is not bad because the body's trying to maintain rigidity in the artery. It doesn't want it to fall apart. But as you get more and more calcification of your arteries, you get a narrower artery, and then you flick off a plaque, and it downstream, and it whacks. You don't get blood flow, you get a heart attack, and then you have the whole host of problems. So we want to do what we have to. There are several things you've got to do to cut down on inflammation. First, you got to eat right.
Right.
The first and foremost thing you can do.
You got to fuel your body right. If you put the wrong fuel in, you're going to be in trouble.
So Hippocrates said, let food be your medicine, let medicine be your food. So my recommendation is eat a keto-friendly eating program. Dramatically reduce your simple carbohydrates, all the things you're used to eating, breads, pizza, pasta, cookies, cakes, potatoes, rice, all this corn. Eliminate it initially for a period of time, a month or 2 months, and have it occasionally, but not all the time. Cut sugar out of your eating program. Use stevia or erythritol. Don't use any of these, the sucralose and all this other stuff. Don't use aspartame. Use something natural if you need sweetener. That's fine. So that's the first and most important thing you can do is clean up your eating program. The other things you can do is make sure your hormones are well balanced. So this goes for women as you go through the change of life. You should be on hormones, but not on Premarin. You should be on natural, bioidentical, biased, and it ought to be balanced with progesterone. So we do that here at the Hotze Health and Wellness Center. It's also very important to have good thyroid function because we know people that are hypothyroid tend to develop coronary artery disease. So you want to make sure you have good thyroid status, which tends to deteriorate as we age. And then in men too, testosterone can be very important because that's very important for thyroid function, conversion of the inactive thyroid to the active thyroid. That's very important. And good vitamin and mineral support. So we also recommend coenzyme Q10, which is very important, magnesium, L-carnitine, which helps you convert fat to energy within the cells, and D-ribose, which helps your body produce ADP, which is the energy molecule. Your cells, inside your cells, you have power plants called mitochondria. Think back to biology. That mitochondria are power plants that produce electrical energy. You're full of electricity. If you're running low voltage, your cells aren't going to function well, your organs aren't going to function well. We want you to be high voltage, and we want you to be a live wire. Now, what are we going to do about the glycocalyx? None of these things really address the glycocalyx. And this is what's really remarkable and has been an eye-opener for me, is a product that I was introduced to called Artiracil. Artiracil. Now, Artiracil addresses the breakdown and the regression in the glycocalyx as it deteriorates from the inflammation, right?
Correct.
So
correct.
Tell us about Artiracil and what it does.
It's a seaweed extract. It's an extract from seaweed.
Okay.
The analogy that I like to use is this. I have a driveway with pavers.
Right.
It's not a driveway that is done with
concrete
or concrete or anything else. It's pavers.
Right.
They're forms, they're bricks that are there. Once in a while, and sometimes, they break.
Okay.
They crack. In the wintertime, for example, guys came through. I said, don't bring the plow in the driveway. If there's one lifted, it's going to hit it and it's going to crack. Guess what they did? I wasn't home. They came through, ran it, cracked the brick. But it's okay. I have extra bricks that match that. And that's exactly what they did was they took a brick, they changed it, they put it back. That's exactly what Artiracil does. The way you think of it is this. There's this lining on top of that single-celled layer. It gets damaged. It breaks. What this does is that it comes in, and because it has the same molecular structure that the glycocalyx does. This particular seaweed has the same molecular structure as the inside or the glycocalyx itself. So what it comes in and it says, oh, we recognize this, we'll fix it. We will come in and we'll relay those bricks and we'll fix it. And that's exactly what the Artiracil does.
Okay. Tell us, how did anybody ever figure that out? How did it happen? Who figured this out about using a certain specialized seaweed and thought, so we're going to give this and see if it doesn't help the heart?
Well, that's a very interesting story. There was a gentleman, first of all, the glycocalyx was found by a researcher in the Netherlands.
How long ago was that?
probably now 25 years ago.
So 25 years ago and
30 years ago. Maybe?
And listen, I'm going to tell you, 99% of the doctors couldn't tell you about glycocalyx.
No,
I'm talking about cardiologists.
I've spoken at heart meetings and asked a question. They have no idea what I'm talking about. So, and then what happened was that there was a company that came to me about now 13 years ago. I was looking at the timeline recently. And there was a gentleman that was working. Actually, he was in Oklahoma.
Right.
He came to me, and the group came to me and said, "Hey, Derrick, we're interested in doing this. We know you do natural therapies. Would you work with this gentleman?" I said, "Absolutely." So I got very interested in this, and I cannot take credit for that because he's really the one that found the structure and that fact that this particular seaweed released a certain compound that was very protective to the blood vessels. So this particular compound, and I don't want to get into all the science in detail, but this particular compound was protective for the blood vessels, and it was almost like giving the people a blood thinner. But it wasn't a blood thinning effect. It had a protective effect to this. We got very interested in this, and then we started to develop some technology around this where we could actually measure and look at the glycocalyx itself. So we had some technology back then that we were using. It was it looked like a thermometer that you put underneath your tongue. There's other technology today, and it really evolved. And I was very much involved in that. And I told this gentleman, I said, look, you're going to win a Nobel Prize in medicine one day. First of all, there's two things I want. One, I want a picture with you. And two, I want my name on one of your papers. And he said, Derrick, we'll do that. So, this is groundbreaking. I mean, this is earth-shattering, because the more people that know about this, the better it's going to be to protect their heart.
Well, tell us. We've done some studies have been done on
Yes,
this. So
yes.
let's talk about the 5 different things that is shown. First, about carotid plaque reduction.
Carotid plaque reduction and the intimal opening.
Right.
I mean, the data on this is really, really, really remarkable, because we have specialized MRIs that we looked at. And in fact, we're now going into, and we've talked about this, into artificial intelligence, because you could have a calcium score of 2,000. That's very high. But if that calcium score is 2,000 and that calcium score is hardened plaque, you're not at risk. Whereas if your calcium score is 2,000 and you've got plaque that's vulnerable, that's hemorrhagic, that's ready to break off, that's a problem.
Right.
That's where the Artiracil comes in, because it stabilizes the glycocalyx above that, and that plaque now becomes non-vulnerable. Right? So that's number one. The other study was elasticity.
Right.
We want blood vessels to be elastic. We don't want them to be hard, right? The more elastic they are, the better, the lower your blood pressure is going to be. The other study had to look at what is called leukocyte function, on
which are the white blood cells.
White blood cells, and how those white blood cells roll. It was a rolling test, because as soon as there's inflammation, the rolling doesn't happen. It kind of sticks and stops. As soon as you fix the blood vessel, they start to roll again, which is what we want, right? Because plaque and not plaque, but cholesterol and everything will go right through it.
They've also done studies where they've showed that using Artiracil, the glycocalyx regenerates.
Rebuilds, regenerates. Yes, over time, it will rebuild and regenerate. There's a gentleman that was working with us about 13 years ago, and this guy was a smoker. And I said to him, you got to stop this stuff. I mean, this is many years ago. And he said, Derrick, I'm addicted to this. I said, all right, well, I can do things that'll unaddict you. I mean, you got to stop it. So what we did was we made him go out and smoke 2 cigarettes, and we had him eat a hamburger from a fast food place, and you can figure who that was, and some French fries. Oh, and he also drank a carbonated beverage that was high in sugar. His glycocalyx, when we were measuring at the time, and I'm going to use a number, 10 is normal. He started at around, I think he was around a 4. After he came back, he had nothing left. Between the cigarettes, the drink he had, and the food, it was gone. Literally gone. And that's the same thing that happens in the diabetics. They have no protection. The armor, it's like going into battle with no armor and saying, shoot.
And well, that's an interesting analogy. The glycocalyx is like armor.
It is armor.
For your arteries, for the endothelial lining of your arteries. It's armor. It's protective. It's a shield.
That's exactly what it is. And we called it that armor. So this data has been done. This has been looked at. I've been on this product personally for probably 10, 12 years. And I mean, I'm not perfect. I don't eat perfectly. I eat very well. I exercise. I work out. I take care of myself. I'm on hormones. And I can, I play competitive tennis. I play competitive pickleball. And I can do it. I can still do it. So don't mess with me, not you. but but seriously, there's a reason, and there are ways to get to a better quality of life if you do some simple things.
Well, I'm so glad to have you here, Doctor, and explain this new therapy that we really have, or new
A new way to look at.
a new way to look at what is causing heart disease and what you can do to get your heart healthy. That's what we want to do. And so we said, just in conclusion, we said, first and foremost, eat healthy. For crying out loud in a bucket. This is not rocket science. Don't tell me, I got a heart. Eat healthy. Take here. What I believe at the Hotze Health and Wellness Center, we encourage you, take charge of your health. It's your health. Your doctor's not in charge of your health. The insurance company's not in charge of your health. The government's not in charge of your health, and your spouse is not in charge of your health. Nobody's going to take charge of your health. If you don't care about your health, nobody else is going to care about your health. And a drug's not going to solve your health problems or your unhealthy problems. The only thing that's going to solve your problems is taking charge of your health and then doing some major changes first in your healthy eating program, making sure you got your hormones balanced out and replenished. Make sure you're taking the right vitamins and minerals and nutrients. And for the heart, we recommend coenzyme Q10, magnesium, L-carnitine, D-ribose, and now we also recommend Artiracil because we want to make sure that the armor that's inside the lining of your arteries is healthy, and that's the glycocalyx, and the Artiracil helps regenerate the glycocalyx, and you want to have healthy glycocalyx, healthy, strong armor there to fight off and prevent you from getting any plaque buildup, which ultimately can lead to, narrowing of your arteries and ultimately getting a heart attack. So we want you to stay heart healthy, and if you're heart healthy, we know you'll have a better quality of life. I've always, in my experience, and you can probably affirm this, doctor, and underscore this, in your practice, haven't you found people that are healthy tend to be happier than people that are sick?
Oh, absolutely.
So if you're going to be alive, you might as well be alive. And if you're going to be alive, then you might as well be healthy while you're alive. And these are some simple things that you can do to be healthy. So consider...
There's a word. Excuse me for interrupting
What?
you. Not lifespan. Health span. There's a difference between the two. I want you to have a healthy health span, not a lifespan.
There are a whole lot of people that are among the walking wounded, and they got one foot on a banana peel and another foot in the grave, and they're barely getting by. We don't want you to barely get by. We want you to be full of energy, full of vitality, and brimming with enthusiasm for life. And there's no reason in the world, I don't care if you're 40, 50, 60, 70, 80, 90, you ought to feel that way, and you can. And so these are some simple methods. So I want you to consider if you have a family history of coronary artery disease, even if you don't, there's no way that you're not going to benefit long-term from beginning a good healthy eating program right now when you're healthy, good vitamin and mineral supplementation, hormone program, and then making sure you keep your glycocalyx healthy by taking Artiracil. Thanks so much for joining us today. Thank you, Dr. DeSilva.
My pleasure,
sir. It was a
sir.
great webinar.